Hey, welcome to The Road Less Traveled. I am your host, Kendra. And on today's show, we will be discussing a topic that unfortunately is something we really don't discuss enough until something bad happens. And that is the topic of mental health. And actually, since we are in the month of May, that is designated towards mental health awareness. And so I felt like this would be the best time to have this discussion. And in order to do that, I have a very special guest on the show today. Her name is Dr. Christy Arnold, and she is the Executive Director at Lift DC, which is right here in the Washington, D.C. area. Now, throughout her career, she has primarily served in community-focused organizations, developing programs and conducting groups centered around life leadership empowerment, substance awareness, and sexual abuse, to name just a few. And in addition to that, she's provided counseling services to families, couples, youth, and young adults. So, Dr. Arnold, welcome to the show, girl.
Thank you so much, Ginger. Thank you for having me. Happy to be here and really happy to discuss a topic that often doesn't get enough of a spotlight.
Absolutely. And going into and kind of talking about that, why do you feel like there's such a stigma that surrounds mental health, and especially in the Black community?
Yeah, wow. Well, I think the main reason why there's such a stigma around mental health, I would say in the U.S. in general, this country in general,
Okay.
and certainly within the Black community, is because for some reason mental health is always connected to weakness. It's also always connected to something that you can seemingly get over, as if it is not a disease in and of itself, as if it is not something that individuals need to seek help for, need to take medication, and as if it's not something that in the medical field is not being studied just as any other illness or any other disease that someone has. And I think the knowledge around that just doesn't seem to be out there. It's still viewed as something that is under someone's control, and that they can get the help. And so as long as we continue to treat it as such and not treat it as something that truly is an illness and someone is really struggling with this, then I think it'll probably always have a stigma attached to it.
Why, especially in the Black community? Why do you feel like?
Well, the biggest thing that I would say in the Black community stems from, again, I think a lot of times within communities of color, and particularly within African American community, a sign of strength is such a sign of growth and that you're on the right path. And the minute you share that you are not quite yourself, or that you are feeling withdrawn, very anxious, or any of the signs and symptoms of depression or anxiety, then immediately you are shunned in some kind of way. And I think a lot of times also within communities of color, it's been a lack of trust around being able to talk to someone about this in the mental health field. It's not something that you tend to hear. A lot of Black families are discussing, like, did you go get a mental health checkup? Have you talked to a clinician? I think sometimes we're still struggling to get African Americans to go get their medical checkups and things of that nature. So certainly to add this mental health piece with a lack of trust around it is extremely difficult. And I think the third thing is because a lot of times within communities of color, specifically in Black communities, we immediately go to our faith on a subject like this. So we immediately kind of go to a space of, I can pray it away. I will talk to my pastor or maybe one of the elders of the church. And so again, because it's still not being recognized as a legitimate illness and something that someone really has to seek help for, when it is kind of marginalized in that way, then it's not being addressed properly.
Okay, and you kind of mentioned the church. So at what point, because you and I, we're Christians, and you're actually the co-president for the Agape Ministry at Alpha Street Baptist Church, which is also where I go to church at. So you have that really good balance of medicine and faith, like when it comes to mental health. So at what point should we stop relying just solely kind of on praying it away, and then also moving forward to speaking to mental health professionals?
Yeah. Funny that you should say that. The example that I always use whenever anyone asks that question is that, now with so much information around breast cancer awareness, prostate cancer, and those have been two forms of cancer that have greatly impacted the Black community, that now if you were to feel that lump in your breast, or if a man were to have problems urinating, or, he's just noticing that when he's going to the restroom there's difficulty, he or she eventually would say, let me go to the doctor, something might be up. And eventually you get to a point where trying to either self-medicate, use some of grandmama's remedies.
Yeah.
You start to realize that that's not working. And so eventually you go to the doctor and you're like, hey doc, I was doing my breast self-exam, or in the case of a man, I was, going to the restroom and had some complications. To me, it's the same vein. It's in the same vein with mental health, is that if you start to notice your thoughts aren't quite what they normally are, if you notice that you can't stop thinking, that you are constantly thinking and having thoughts that at times don't quite feel like you. Like if you start to have thoughts where you feel like, why am I so worried about this all the time? Or why is it that I feel like I'm seeing things that may not be there for someone who might have, hallucinations and things of that nature. I think once you get to that point where you even notice something about me is different, then the same way you would do with that lump in your breast or with prostate issues, prostate challenges, go get the help. But we aren't doing it because, again, I think there's still a lot of, like, mental health feels mystical to people. It still feels like something that is like, you're okay. Just go to sleep. You've just been so stressed out. You've been worried so much about things and doing a lot at work, and then you got this at home. Just get some rest. And while that is certainly beneficial, when I work with clients, one of the first questions I do ask them is, how much rest have you gotten? But it is not the end all be all. It's just not the cure. And I think sometimes that's where we go with it. But I do, to your point about in the faith-based space, I think that the two should work together, and that prayer and coming to church and talking to elders, it has a place in your healing and in your recovery. But in the initial diagnosis, in the initial something's not quite right, you need to go seek help and seek medical professional services, or mental health professional services. And by no means would I tell you not to pray after you get that diagnosis, but you can't just pray it away in that sense. Okay, that makes sense.
Excuse me, so can you give me just some signs, like maybe I believe it's 5 signs or symptoms to emotional stress? Can you discuss that a little bit?
Yeah, definitely. Recently just spoke to a bunch of young adults here at the church about emotional stress, because I tend to find that a lot of times the younger generation seems to be a lot more open to recognizing mental health issues, and that's not to say the older generations don't, but sometimes I think for me it seems like I have more of an open ear. So I just spoke to a bunch of young adults about the 5 signs of emotional stress or emotional pain. And one of them, or the first one, is when you start to notice like a personality change. And the example I gave is, it's rare that if someone's been an introvert all of their lives and now all of a sudden they're a huge extrovert and now they're the life of the party. We usually are our core personality is pretty much so the same. Secondly, if you notice that someone's very withdrawn and just not participating in anything, and just almost kind of to a point where they're just like, no, I'm good. And it's like, well, we were just going to take a walk, in a park. And it's like, no, I don't even want to do that. Thirdly, if you notice, completely irritated and agitated, just like everything kind of just any and everything sets a person off, and you're like, well, what's going on? I don't think this really warrants that. This situation is not that serious. Fourth, I would say poor self-care. So one of the things that we in the mental health field, we can always tell when something is not quite right when a client walks in and maybe hygiene is not appropriate or up to par. If the client starts to share very risky behaviors, if they're starting to, now they're drinking alcohol or trying all of these risk-taking things and trying to be dangerous in that regard. And then the fifth one I would say is a level of hopelessness. When someone is just completely, they have no hope when it comes to the future. There's no joy. A lot of comments about things not working out, and it's like, wow, it hasn't even really kind of taken off and you're already predicting that it's not going to work. And usually in that one, in the fifth category, is when you might hear some suicidal thoughts. And so that's like the major red flag for us.
So if you do recognize those signs, what if you recognize that as a loved one, how do you move forward in getting them help, especially if they refuse or they say, I don't need help, like, what are you supposed to do?
Right, like most people.
Yeah.
Well, I will say this, and I guess the caveat I'll put out is that this answer is not going to be something that most viewers will like.
Okay.
And so, right, that's just my, like, don't hurt me, don't, shoot the messenger. But the first thing is that you may want to talk to a mental health provider yourself and let him or her know, hey, my friend, my loved one, just doesn't seem to be behaving in a way that I am used to seeing them. Their norms and their values and the way they behave is just completely different. And so he or she may say, well, I'd love to see them. You can bring them here to the office. You could also speak to your medical professional. You could also ask them about bringing in a friend or a loved one, like, I'm noticing some serious changes, would love to bring them in. Because medical professionals and mental health professionals really work closely together.
Okay.
Or should I say, medical professionals that know to have that relationship with mental health professionals.
Okay.
When they see certain signs and certain behaviors, they'll say, we tested you for this, we tested for that, I think we need to now make a referral.
Okay.
And then the third one, and this is the one that I think can be a bit uncomfortable, is if the relative or the friend or family member is showing extreme behavior to a point that is no more where you're wondering if something is wrong. It's clear something is wrong.
Okay.
And you're trying to get him or her to go get the help and they won't do it. At some point you have to call either your local mental health emergency crisis line in your community, or you have to call the police. And the reason why you have to possibly call the police is at times if their behavior is to a point where they're a danger to themselves or to others and they just refuse to help, then now even though you might feel bad about it, you actually are doing the best thing for them. Because when you call the police, you're going to let them know these are the behaviors we're seeing. We've seen it for a while. They're absolutely refusing to go to the hospital for me to take them to the ER so that they can get this help. Well, when the cops get there and the cops assess something right, then whether they want to go or not, they have to go. And the cops, the police or law enforcement will take them to immediately, usually to the psychiatric unit. And so now that help that you wanted them to get, they're now going to get it. And so I've had a couple of cases like that where the family members have talked to their loved one about, please, you need to get help. It is clear that something is going on and I don't know what to do. And the person refused. And so finally, we advised them to call the police. And once the police came, the family explained, this isn't like criminal behavior. They don't need to go to jail.
Right.
They need to go to a psych unit. And the family member was able to get on meds and be stabilized. And of course, the family is devastated because no one, especially if you talk about communities of color, we don't exactly want to call the police.
Right.
Exactly. We don't exactly want to bring them in. But in that regard, if that's the only way that they're going to go to the psychiatric unit to get help, you might have to resort to that.
Wow. So then even and I don't know if it would be kind of the same solution to what if you already have a loved one who has been diagnosed with a mental disorder and they're still like, all right, I've been diagnosed, but I don't need this medicine, I don't need it, I'm cool, I did enough, so leave me alone. So is it still kind of the same thing?
Sadly, it can be. So the one thing with that is the good thing that you have is that if they have been diagnosed, they are taking medication, then at least you're not dealing with someone who's in denial. You're not dealing with someone who is completely like, what are you talking about? So you have a little more to work with there, where if you have any contact or connection with their mental health provider, that you can maybe call him or her, and even though they won't be able to share anything with you because of HIPAA, you could at least reach out to them or encourage them to reach out. You could try that, but I hear what you're saying is that if they're just like, no, I'm actually good, I'm taking the meds, and I've now come to realize I'm fine, all is well. Well, unfortunately, usually for someone who gets into that space, you start to see a downward spiral. And then if it gets to a point that they just won't get back on the meds, they won't go get the help, and you may have to resort to that same advice I gave earlier. I tend to take the road of calling the emergency psychiatric crisis line. Many counties and in various cities almost every county has a psychiatric emergency hotline
Okay.
where you can call them and they will send somebody out. And so
Mhm.
that's not quite law enforcement, so it's
Yeah.
not as intimidating.
Okay.
But if it gets to a point where the person starts to become hostile,
Yeah.
you gotta call the police because
Mhm.
now they really could be a threat to themselves or
Mhm.
others.
Okay. Okay.
Yeah.
Wow. So how could we help, say, a loved one who's dealing with maybe an emotional or psychological trauma, such as maybe they lost a loved one, they lost a job, an injury, just something that's really had a huge effect on them, and like through that grieving process, we know we all have our bad days and we all can get down about things, but at what point does grieving now suggest you need to speak to, a therapist or mental health professional?
Well, I think the biggest thing is when our friends and loved ones have like a major life upset, and that's what I like to call it, because life will definitely not always be this smooth line. It's
Yeah.
got a lot of highs and lows. And so when we see loved ones experiencing that, I think initially, to your point, we do give them their space. And I'll go to the one about grief or the death of a loved one. People do need their space initially. Everyone grieves differently. Some people immediately get back to work. Others take some days, and it's like, look, I can't function at work. I can't do it. So initially, I would say the first couple of months or so, it's actually not abnormal.
Okay.
If someone's grief or someone lost a job and they're just like, oh my God, how am I going to pay my bills? Like,
Yeah.
who wouldn't be, upset and emotional? So I think in the beginning, you do kind of give them their space. You might check in on them every now and then, like, are you okay? Is there anything I can do? Can I help? But if you start to get to a point where, we're crossing into 6 to 9 months is usually the range. And I say that loosely because as clinicians, we have to ask a lot of questions before we can pinpoint the actual time that seems to be an issue. But when it starts to get to that point, then that's when you start to have those same conversations about, hey, I love you, and I'm noticing that you're not seeming to kind of bounce back or to be yourself, and it seems that you're in a position that I'm really concerned about you.
Okay.
What do you think about, going to talk to someone and I can go with you? And I can be there with you, that support. Or if you know of someone who has gone to someone and it's like, oh, a friend of mine experienced the same thing. She saw a clinician, would love for you to talk to her or him. So I think when we stop making this something that is happening to others and it's not normal when it actually is normal. There are many people that are struggling with challenges and with grief and with loss and death and depression, anxiety.
Yeah.
And the minute we can normalize it and make it something that is not so them and those people and others deal with that, then I think people will be more open to getting the help. But of course, the biggest challenge I would say in the mental health field is the one that I always hate having to share with laypersons, is that you can't force anybody to go in the way that you want them to. Like, you can see it and you're just like, no, you need to go get help. I'm watching this go downhill and I'm watching this spiraling out of control.
Yeah.
But if they just refuse to go, then they refuse to go. And then it almost gets to a point where you do have to now call the psych emergency crisis hotline or call the police to come out. And you were so trying to avoid that.
Right.
But if they're not a minor, if they have not tried to harm themselves or harm others, if there's been no threat or no hostile or violent behavior, you can't force anybody to go. All you can do is continue to inform, like if you were to tell a mental health professional, I need to keep a record or a log of this. So if you went to your local hospital and was like, I'm just calling to let somebody know my brother has not been behaving like himself for about 3 months now.
Okay.
And I want some record of this somewhere.
Yeah.
And that's what you can do. But again, not being a minor, if they have not done anything to threaten you or themselves or anything violent or hostile, it's very hard to say you have to go. So you just keep doing your check-ins, keep encouraging them to go. And like I said, going with them is always beneficial. I've escorted people who were like, I'm not doing this.
Yeah.
And also if you know of someone who's experienced that, or if you have a mental health professional in your circle of friends that can help to normalize it and help the person to see this is no different than if you felt that lump, if you something was going on down there with the guys,
Yeah.
you know. Or we can even get even more simple. If you kept coughing and the cough wasn't going away, this could be bronchitis. So let's not let it get to pneumonia.
Right.
You know,
Right.
so it's the same. When I use a medical metaphor for mental health, people tend to get that a little bit.
Yeah, that does make it it makes more sense when
Mhm,
you put it like that.
mhm.
Absolutely.
Mhm.
Okay, and so have you noticed a rise in depression cases that may have been kind of related to social media? Because I know the popularity of social media, everybody's on there, and it's kind of like you can get on social media and maybe people start to try to compare yourselves to someone else or body images and things of that nature. Like, have you noticed an increase of like depression or just mental illnesses connected to social media usage?
Yeah, sadly, funny, I hear my grandmother, she would hear, she was like, social media is the devil. Because the funny thing about social media is that the beauty of why it was created was to connect individuals, right?
Yeah.
That we could talk to our fellow brothers and sisters over in Africa if we wanted to, through Facebook, through Twitter, through Instagram, and all of those things. And so from a connecting standpoint, I love social media. I have my own, social media pages, but I think the very thing that it was meant to do from a positive has become the very negative. Because it is now overexposing things and is now planting ideas that may not have been in your head until now you see it on the World Wide Web and you're seeing other people doing things. And so now I think one of the biggest things that's happening, like this new craze that's going around, I hate to use that word craze, the new popular thing, and I hate that it's popular, is this new thing with teens committing suicide and videotaping it. And I'm like, okay, this is disturbing in a way that I don't even know what to say as a mental health professional. Like, as a Christian, I'm extremely disturbed, 100%. And a lot of times they're saying that some of the teenagers are getting the ideas of how to do theirs like even better, or how to do theirs in a certain way for what they've seen another teen do. And I'm thinking, okay, this maybe grandma was right. Maybe social media is the devil, because I mean that is absolutely crazy. And so I think for me, social media is this beautiful, wonderful thing that when misused, it becomes an ugly monster, an absolute ugly monster. And when I think about, some of the original creators of these different social media that we use, they had none of that in mind. They were just thinking like, oh my God, you're going to be able to connect with people all over and friends that you haven't seen. I've connected with high school friends, college friends. And it's just absolutely wonderful when it's used for that. And with the younger generation, I'm noticing at times this irresponsible use of it. And I don't know if that's a matter of the parents need to put boundaries on it, but then once they're on there, you might not be able to see what they're always saying all the time. I really have no clue what the best way is to reel in this social media monster, this social media thing, other than, like I said, parents monitoring the access and what their children have, and also having that conversation with them about, if you see something and it makes you want to do what you saw, talk to me about it first. Like, we need to sit down and talk. I think the parents of this generation have to be much more open with conversation. And I think a child of this generation, a millennial, has way more stress than previous generations, and because they're so exposed, and it's like in one breath you want your child to be exposed, and you want them to have access to the world beyond their little microcosm that they live in. But now it's the danger of that now my child is exposed to things that I didn't want them exposed to. So the only thing I can think of for parents is to have those very open conversations, open dialogue with your children about, if you see something and you're thinking about doing it, or it sparked an interest, talk to mom, talk to dad, and let's have a dialogue about that.
Awesome. Well, Dr. Arnold, thank you so much for coming on the show today. I have learned so much just by sitting here and speaking to you, and I really believe it's going to be a blessing to the viewers that see this as well. Is there a way that they can connect with the Agape Ministry here at Alfred Street?
They can. So the Agape Ministry here, the best way to reach us is through email, agape@alfredstreet.org. While Agape serves primarily Alpha Street Baptist Church members, if any of your wonderful viewers reach out to us, we can certainly point them in the direction of a mental health provider. Some of the members of Agape are in private practice themselves. We also have colleagues throughout the DMV area that we can refer individuals to. And certainly if someone outside of this area, because we are speaking that this ministry of yours is going to go beyond the DMV, right? Right, exactly. Beyond the DMV. So for many of us, we're not from this area. I myself am from Atlanta. And so I have tons of colleagues and friends that I could refer down there. So we can get you where you need to go. So,
Awesome. And I'll definitely make sure that I put up some resources as well, connected to the bottom of this link for this video. But again, I thank you so much, Dr. Arnold, for coming on the show. I thank you viewers for tuning in. I hope that you all enjoyed it. Please make sure you subscribe to my channel. Make sure you like the video. Leave some comments. Let me know what you think about it. And always remember, faith over fear. Until next time.